My name is Dr. Dana Chase. I'm a gynecologic oncologist with the Arizona Center for Cancer Care in Phoenix, affiliated with Honor Health Research Institute. And I today discussed several abstracts that were presented at ASCO in the oral presentation session. Two of the abstracts were in the ovarian cancer space, two were in the cervical cancer space, and then the final one was just an update about COVID-19 in our gynecologic cancer patients. In general, to summarize, ovarian cancer patients potentially will have a third PARP inhibitor called rucaparib available for them in the frontline setting. We'll see who is eligible to get this treatment. Is it biomarker positive patients or not? We'll see, but potentially rucaparib could be available for frontline use after a response to platinum-based chemotherapy. The second abstract was a really interesting new target in our platinum-resistant patients. This is a glucocorticoid receptor modulator, which is an oral therapy that can be used on this trial in combination with nab-paclitaxel for patients with platinum-resistant recurrent ovarian cancer. This is a group with a high unmet need and a very poor prognosis. And potentially with this new agent, we're looking at whether or not we can extend the duration of response and maybe reverse some of the chemotherapy resistance that these patients experience. And the trial was interesting, definitely looked like potentially it's active in this patient population to extend their duration of response with the nab-paclitaxel. In the cervical cancer world, we had two abstracts. The first looked at subgroups of the KEYNOTE-826 patient population. Specifically, the subgroups that they wanted to look at was whether or not those patients received bevacizumab with their pembrolizumab and chemo, whether or not they had prior chemo-RT, whether or not they received cisplatin or carboplatin, and whether or not they were squamous or non-squamous histology. So there were some interesting findings. It's just hypothesis generating because this was not a primary endpoint of the study. Potentially all those groups did respond, but we definitely saw some differences in magnitude of response potentially with some of the different subgroups, which I would encourage you to look at. And then there was another study discussing pembrolizumab with tisotumab vedotin, either in the frontline setting, in the second or third line setting, and then in the frontline setting with carbo, not using it with pembrolizumab. And definitely across those three groups, we saw really interesting and significant overall response rate. And again, duration of response was impressive. And potentially we're going to see some new agents introduced frontline, hopefully down the road. And then finally, just a COVID-19 update. Who's at risk for developing severe complications from COVID-19? Potentially, if your COVID-19, if your GYN patients gets a COVID-19 infection, potentially there's maybe between a 16, 17, 18% mortality rate. Who are the patients that are at risk for severe complications from COVID-19? Maybe non-white race, maybe higher comorbidities, and then definitely patients that have progressing disease, that have active cancer are potentially at higher risk. And interesting in this abstract, only 4% of the 800 and so patients that were looked at had gotten a COVID vaccine. So interesting retrospective data to consider. So probably the abstract that we're going to see make a difference sort of immediately in the near future would be the Athena abstract, which is having a third PARP inhibitor that we can use in the frontline setting. Again, having options is important in terms of therapies we prescribe. That is going to be probably the most clinically important abstract for the next year or so. The other abstracts, definitely exciting, definitely potentially make you think a little bit clinically about who you're prescribing your therapies to, and maybe down the road we're going to see some changes in therapies available to our patients based on those other abstracts, but probably not within the next year, I would think.